Good afternoon, and welcome to the Ocean State Current. My name is Mike Stenhouse, CEO for the Rhode Island Center for Freedom and Prosperity. Today, we have a little bit more of a regional, maybe even national audience as compared with our normal shows. So we welcome you to the Ocean State Current, which is the news and media outlet for our Rhode Island Center for Freedom and Prosperity. Soon speaking with you today will be Dr. Stephen Skoly, the plaintiff, a Cranston-based oral and maxillofacial surgeon who also happens to be the chairman of our organization, and Brian Rosner, the senior attorney for the National Civil Liberties, the new Civil Liberties Alliance, who prepared the lawsuit today. We're going to get some statements from myself, from Attorney Rosner and Dr. Skoly in just a few minutes, and then we're going to go into extended interviews. So first, we'll do some statements. From my perspective, Dr. Skoly, who's a friend of mine, not only our chairman, should be considered a hero in Rhode Island for standing up for what he believes in. Not only is he protecting his own valid personal medical health concerns against a vaccine that's potentially dangerous for him, but he's also standing up for every Rhode Islander who's been unjustly forced to leave their jobs because they made what they thought was a free choice not to comply with Rhode Island's unconstitutional healthcare worker vaccine mandate. But unfortunately, that choice indeed was not free. And the high cost of non-compliance imposed by this state of Rhode Island are costs that were unthinkable to most of us just a year or two ago to ever occur in a free society. It's now been 125 days since the state of Rhode Island, without any due process afforded to him, barred Dr. Skoly from seeing his patients and providing them with the critical care they require. This persecution of Dr. Skoly, make no doubt about it, is political and personal and has nothing to do with public health. Despite overwhelming evidence that the policies enacted by this Rhode Island Department of Health and by Governors McKee and Raimondo, they have failed miserably and they should be immediately abandoned. Evidence that gets stronger every day supports Dr. Skoly's case, but yet Ocean State health officials and politicians remain stuck in gear. In fact, this week, the General Assembly has taken initial steps to even extend these irrational emergency orders for another 2 months. We don't know what's going to come of that. The public outcry in this state has been huge, but they have taken those initial states to issue these orders under a faux state of emergency. Neighboring states, other countries are already changing and abandoning those oppressive lockdown and mandate policies, yet not here in Rhode Island. This legislative action, if it passes, will clear the way for the extension of executive orders that have been proven not to provide any public health benefit. It's unbelievable. Indeed, irrational and what I would call vindictive actions by Governor McKee and the Department of Health in shutting down Dr. Skoly's medical practice are purely political and personal. Here's why. On the political front, the governor is under enormous pressure from teachers' unions and his left-wing gubernatorial opponents in the Democrat primary this fall to continue those oppressive measures, fully knowing they don't work, and leading to this self-inflicted healthcare worker crisis that we're facing in this state. There is no medical or public health reason why Dr. Skoly and other unvaccinated healthcare workers should not immediately be reinstated. A far better solution would be to bring Dr. Skoly and his colleagues back rather than bringing in the National Guard or allowing infected healthcare workers to see patients. On the personal and vindictive front, my sources have informed me that Rhode Island Department of Health officials believe that Dr. Skoly is being singled out in large part because of his affiliation with that conservative group. That's our center, of which he is chairman, our Rhode Island Center for Freedom and Prosperity. The personal persecution goes even further, as Dr. Skoly himself, and for a period of time, some of his staff are even being denied unemployment benefits that they have been paying into for decades. For these and other reasons, Dr. Skoly and his legal team are announcing today that they have filed a lawsuit to reinstate Dr. Skoly's right to care for his patients and to earn a living. That was my perspective. Now for the official legal perspective and for Dr. Skoly's perspective, let's first turn to Brian Rosner, new Civil Liberties Alliance attorney, who will tell you what you need to know about the lawsuit. Brian, take it away.
Thank you, Mike. As Mike introduced me, my name is Brian Rosner. I'm a senior litigation attorney. There are several of us, both senior and less senior, with the new Civil Liberties Alliance. We're a non-profit civil liberties organization based in Washington, D.C. And essentially, we bring lawsuits on behalf of individuals and businesses who have really been misused by government power and government regulation. We brought a lawsuit this morning on behalf of Dr. Skoly, who we think is a victim of such government misuse. I'm really not a political person. I don't know anything about Rhode Island politics, right or left or in the middle. But the problem regarding Dr. Skoly is that the government has acted in a manner to him which basically is irrational and capricious. And that is the basis of our lawsuit. See, what happened is that I heard words of defiance and compliance regarding this regulation in Rhode Island. Well, actually, the problem here is that Dr. Skoly is in compliance with a Rhode Island healthcare regulation. The regulation basically said you must be vaccinated by October 1st of last year in order to continue to practice medicine in Rhode Island. Or Dr. Skoly, for reasons which we can get into, for solid medical reasons, cannot be vaccinated, as well as being that he has natural immunity. But in any event, the fact is that he couldn't comply with the regulation. He was given an order of a compliance order, basically saying you can't practice until you get vaccinated. And Dr. Skoly has been acting 100% in compliance with that order. So the issue isn't really Dr. Skoly's defiance of anything. Dr. Skoly is in compliance with the rule, which unfortunately violates his constitutional rights. And this is how it violates his constitutional rights. You know, one can argue over the necessity of a vaccine mandate, and Rhode Island made a decision that they're going to have one for healthcare workers. And the reason for this decision was to protect the vulnerable patient, to prevent the vulnerable patient from being infected by a healthcare worker who perhaps could be carrying COVID. To deal with that situation, which is a normal political situation that a government is supposed to respond to, Rhode Island came up with the vaccine mandate. It's not a total mandate. It does have certain medical exemptions, although very, very, very limited ones. And Rhode Island, though, it made a very critical decision when it created the exemptions to the mandate. It said to people who would be exempted that, if you're not vaccinated, we're not going to make you lose your job because you have an exemption reason. But, we're not going to prohibit you from going into the hospital. We've made the decision that even if you're not vaccinated, if you're exempt, we have an alternative way to protect the patient so that you can go into that hospital and provide the necessary medical care that the people of Rhode Island need. It's right there in the regulation. And it says if you're exempt for an exceptional medical reason, all you need to do is wear an N95 mask.
Right.
And once you wear the N95 mask, you are considered as if you were vaccinated in terms of patient protection. Now, the issue that we are bringing before the court is that, in essence, Dr. Skoly has been unfairly singled out. He's a dental surgeon. He's been wearing N95 masks and engaging in other precautions since March of 2020. He wants to protect his patient, just like the other exempted medical workers who are unvaccinated. But the legal issue is that how is it rational or conceivable to say to 350 exempt workers in Rhode Island, you're unvaccinated, but you can wear an N95 mask and continue to act as a healthcare worker. But you, Dr. Skoly, your N95 mask doesn't count. Therefore, your 40-year medical career must end. That, in essence, is what our lawsuit is about. It's a basic equal protection argument. The laws can distinguish between people, but there must be a rational basis to do it. And there's simply no rational reason why Dr. Skoly should not be the 361st exempt unvaccinated person so long as he wears his N95 mask. And just to add, I mean, it's not that, Dr. Skoly, I've never really discussed politics with him, but he does have a medical reason to be concerned about vaccinations. When the regulation was created by Rhode Island, they created a medical exemption, which was very, very narrowly defined as basically people who have a history of being severely allergic to one of the components of the vaccine. And Rhode Island would not go beyond that in even thinking about other possible medical exemptions. The problem with Dr. Skoly is that he has a history of Bell's palsy paralysis. It's a known scientific fact that there's a relationship between an onset of Bell's palsy paralysis and the vaccination. It's a very, very low risk. And for anyone generally in the community, like myself, I'm vaccinated, but I wouldn't have a Bell's palsy concern because I've never had it in the past. The thing about Bell's palsy is that it's a thing which is in your system. Once you have it in your system, it's always capable of being reactivated and coming again. And if you don't know what Bell's palsy is, it's a facial paralysis which can cause droopiness of muscles around the eyes and the mouth so that you lose your ability to see. Fortunately for Dr. Skoly, his prior onsets were very short and they resolved themselves. But the fact is that Bell's palsy can be a long-term condition of several months, and it actually, in some people, can be permanent. And the science is simply unclear what the danger is regarding the onset of Bell's palsy.
Let's dig into that. Let's dig into that a little further when we get into the extended interview. So you've set it up beautifully. We're going to come back.
One last thing I would like to say. One last point. Also, the fact is that Dr. Skoly is COVID recovered, which, as the overwhelming scientific evidence, is literally coming in every day, study upon study. The COVID recovered are just as immune as someone who has been vaccinated. In fact, they probably even have a better immunity. Yep. So it's just utter, total insanity to prohibit Dr. Skoly from treating the hundreds of patients who've been waiting for his services.
All right, we'll get back to you, Brian, in a minute. Let's bring in Dr. Skoly. And let me just set it up this way, Doc, so you can give your opening statement here. I think what Brian just said is the key thing, that for all the talk we hear about following the science, this Department of Health, outgoing director Nicole Alexander Scott, acting director James McDowell, Governor McKee are not following the science, because if they were following the science, you would be practicing right now. Your thoughts, Doc Skoly, on the lawsuit filed today?
Sure. Well, I'm glad that we finally got around to doing it. That's not the way I roll. I've never sued anybody. I've never filed a complaint against anybody. But when I was initially issued my compliance order, I mean, I didn't even go before the right regulatory board for the hearing process. I'm licensed by the Board of Examiners, and because of the emergency nature of the orders, I went for these Department of Administration hearings, multiple hearings over the course of the last 3 or 4 months. The appeal process completely unsuccessful. The interrogatories that we asked in the appeal process, I'll give you one example of it. Because we were just talking about Bell's palsy or facial paralysis. I, as a young adult, experienced Bell's palsy after a couple episodes of Lyme disease. Thank God I recovered. Again, it was a long time ago. Back then, not a lot was known about Lyme disease and Bell's palsy. But if you develop Bell's palsy as a consequence of Lyme disease, I mean, it's almost pathognomonic for Lyme disease. So in our interrogatories to the Department of Health, one of the questions was, are you aware of, and what is the number of patients in Rhode Island who have developed Bell's palsy status post-vaccination? You can get that answer on the VAERS or the vaccine adverse event reporting system. But and we asked 9 or 10 questions. multiple times. And this is the frustration of my adventure through the hearing process. Their response was they objected. It was not relevant to the case and would be unduly burdensome for them to produce the results.
Not relevant.
Not relevant. And, this is my livelihood. It's my health. As Brian and you have alluded to, I've recovered from COVID. I did well. I have naturally acquired immunity, and I have an issue with developing Bell's palsy at this point in my career. I've been practicing a long time.
And that's science. That's science.
That's science. So this week, when it looked like, and I would have been willing, if I could have gone back, the emergency orders expire in a few weeks, I wouldn't have done this. Again, it's not the way I roll. But it looks like they're going to extend the vaccine mandates and the mask mandates, and everything is so unsure. I have no alternative but to file this complaint in federal court. The General Assembly looks like it's going to either support or not combat, Governor McKee in challenging these continued mandates. They've been conspicuously absent through this whole debate. I mean, I have no alternative but to file this complaint. And going through the appeal process was quite an adventure. When you openly challenge the mandates and you try to get the transparency of government to look at the science, and the science is constantly evolving. And Brian talked about the more recognizable position that COVID survivors now with naturally acquired immunity and antibodies and T-cell memory, we are at least as safe, if not safer, in terms of our ability to contract disease and transmit it. We are safer than those who are fully vaccinated. In fact, in Rhode Island recently, they let COVID positive vaccinated workers into the healthcare system as opposed to COVID negative unvaccinated healthcare workers. I mean, that's insanity.
Yeah.
So that's what I was faced with. And when you're in that position of challenging, the administrative state, quite honestly, I mean, I've never viewed myself as a victim, but you used that term a little bit earlier. I am almost a victim because now I'm classified as, quote, that enemy of the state. How dare I defy their narrative? And the transparency of the science and the information and the hearing process, I mean, it's chaos.
All right. Brian Rosner, as attorney for the new Civil Liberties Alliance. So when you mentioned earlier about Dr. Skoly's equal protection rights being violated, that's per the 14th Amendment to the United States Constitution. Let me read what it says here and then have you comment on it. The 14th Amendment of the U.S. Constitution states that no state, in this case, Rhode Island, shall deprive any person of life, liberty, or property without due process of law, nor deny to any person within its jurisdiction the equal protection of the laws. So as you said, they granted other people exemptions. They refused them to Doc Skoly. That is a violation, correct?
Yes, it is.
You mentioned earlier that you can have unequal treatment if there's justification, but you're arguing there is no justification. It's just an irrational denial of his claims. Would you expound on that a little?
Well, think about it. It basically, you have 350 healthcare workers unvaccinated in close proximity to patients who are vulnerable to infection. But the state has decided we must protect the patients, so you, the unvaccinated, must wear an N95 mask. What conceivable reason is there that they're not treating Dr. Skoly the same way? Is it, and you see, that's the whole frustration that I know Dr. Skoly has had for the past 4 months. we've spoken to the state. We've tried to discuss and reason with them. I mean, there is a healthcare emergency where we don't want to be, obstructive and stubborn if there's a good reason to do what needs to be done. But what is the reason to treat Dr. Skoly differently? I can't even begin to think of a pretext to separate. If you throw Dr. Skoly into that pool to make him 361,
Right.
why you should pluck any one of them out and say, no, but you can't practice. And indeed, we brought the lawsuit out of the frustration that we couldn't get a good explanation, thus reinforcing our view that indeed it simply is at this point capricious and arbitrary. And again, I'm willing to cut the state a lot of slack when an emergency occurs. But the problem is that even for the state, you must take time to reflect upon your actions and be willing to change as new facts come in.
Well, when they're personal and political, when they're personal and political motives, they don't often sit back and reflect. And I think that's exactly how you and I are saying the same thing. Dr. Skoly, you must be at least I know you were discouraged before this lawsuit was filed that more people didn't speak out in support of you, more of your colleagues, but we quickly learned, and I mentioned the vindictive part of this, that this state is openly threatening any doctor who speaks out against a narrative, writes a prescription for ivermectin or hydroxy, tries to write a medical exemption form, that they are threatening these people. But yet, so that explains why they didn't, but yet in this lawsuit, there are over a dozen affidavits from some of your colleagues across the state who support you, who openly came out, put their careers at risk against this vindictive state. That must have been somewhat warming to you.
It sure was. And as this has gone forward and as time passes, I'm getting more and more support. And, I've had those frustrating days where I'm like, oh dear, what did I do? I couldn't have done this 10 years ago. I've worked hard. I've worked hard since I was 15 years old. I feel sorry for those people who didn't want to get a vaccine in other arenas. Certainly there's all the healthcare workers. There's always the first responders. There's those on the front line. What about those that their employees mandated vaccines? And we have this conversation often. And they're like, well, I had no choice. I have 2 young kids. I have a car payment. I have rent. I got to pay my mortgage. I have to get the vaccine or I'll lose my job. What country do we live in when that's happened?
Yeah.
I couldn't have done this years ago.
No, who would have thought of it?
Yeah. I guess I did it now. I'm glad I did at this point, although it's been an adventure. I will tell you that.
Yeah. Brian Rosner, in putting this complaint together, you and your firm really went far and wide. In addition to those affidavits from local colleagues, medical professionals of Dr. Skoly's, you also tracked down an expert on Bell's palsy, a Dr. Pappas, who you write about in the release. And he all but confirmed that, yes, this COVID vaccine is associated with Bell's palsy. So the facts, so tell us, well, that was really some good work on you guys to track him down. Anything else we should know about that situation?
No, but in all of our lawsuits, we believe in the science and we look for the experts to give us guidance in how we make our arguments. I think there's a great deal of misunderstanding regarding what the science is regarding COVID-19. We also have 2 other experts who entered reports basically on the issue of natural immunity, which again, looking at the science, should not be something about right. Which you can always argue back and forth about details, but the fact of the existence of natural immunity and its protective power in relationship to the vaccination. Indeed, the whole concept that the way we're going to get out of COVID is when ultimately everybody is immunized through a combination right. of natural immunity and vaccination.
And it's not just natural immunity that we know of, and the research shows overwhelmingly to this disease, but natural immunity for hundreds of years has been an accepted medical understanding. And yet this state and this Department of Health, again, the Department of Health fails to recognize the power of natural immunity. It's really unbelievable to think about. Dr. Skoly, as Brian Rosner said, the state has essence, without stating it as clearly as he did. They've basically said, well, if you have a medical exemption for some reason that we accept, even if you're COVID positive, you can care for patients as long as you wear an N95 mask. You have always practiced the highest standards of safety with your patients. You have always worn masks. You even wear a face shield on top of that. Are you here to state, can you state clearly today that you would follow the same protocols that these medical exempt professionals are following, or that these COVID positive healthcare workers allowed back? Are you willing to follow those same protocols?
I sure am, and and you've been in my office. Our heightened universal precautions are probably above and beyond what they would require of me. And it's, not to diminish the tragedy associated with COVID. Those that have lost, and certainly the controversy when the pandemic first started. But equally important now, we need to change the algorithm, how we manage infectious disease and how we manage situations like this. The government, the CDC, the WHO, health departments, and doctors, public health specialists, they need to be more transparent, and they need to follow the science. They said they were following the science when, as you look at this now in the rearview mirror, they weren't following the science at all. And the morbidity and mortality rate associated with COVID theoretically is still relatively small. If we ever have something more significant, something that's more of a biological weapon, something that impacts America going forward, it's going to be unfortunate, because the citizens of this country now have lost a little faith in their trusting of the government.
More than a
And
little. More than a little.
Yeah, and something of more significant is going to be catastrophic.
Yeah.
The algorithm has to change. We need to get to a near normal much quicker. I mean, even more sad as what I'm going through, and my kids aren't in school anymore. They're grown up.
Yeah.
But the mask mandates and the irreparable harm that I see in that mandate is going to continue
On the students.
I
right.
mean, that's insanity.
Yeah.
So
Yeah,
this has been an adventure.
Yeah. Brian Rosner, one of the things that's interesting, I think, and different from this lawsuit than most of the others we've seen, is you're not broadly going after a reversal of any of these mandates, whether it's the healthcare worker mandate or the school mask mandate, like other lawsuits we've seen in this state. This lawsuit appears to be very, very narrow in scope. You're just saying because of Dr. Skoly's relatively unique medical condition, and because of the unequal treatment, just let him go back to work. So basically the court can allow Dr. Skoly to care for his patients again without broadly striking down any of these government mandates. Am I correct in that?
Yes and no, but if I can begin by saying the New Civil Liberties Alliance has brought the broader lawsuits against the federal mandates. We've been involved in several.
Right, that's a different lawsuit, right.
And as for Dr. Skoly's case, law, it all really comes down to injustices against individuals. And Dr. Skoly's example was such a sad example of really the state against one person, but one person with such a large impact. I literally, the list of 20 patients that Eleanor Slater in desperate need of surgery that they haven't been seen because Dr. Skoly's been decommissioned, the charity patients not seen, the hundreds of his own personal patients who haven't been able to reschedule surgeries. I mean, this was an instance where I don't want to say it's just Dr. Skoly, because that's important enough, but it had such an effect on so many other people that the NCLA felt compelled that this was the proper case to bring. And also, if I might add, Mike, the way the law works, even were Dr. Skoly to obtain a restraining order against the compliance order, even on the narrowest grounds, it would have certain implications. But again, we don't need to get into those, because basically we're here to get Dr. Skoly back into his office so that it can start seeing his hundreds of patients again.
So just yes or no. So the court could rule narrowly just on a single case without striking down any of the government mandates, right? It
Yeah,
could do that.
absolutely.
Agreed. Could it also, so because we know courts have been unwilling, I think, in large part to overturn executive actions. In this case, they don't have to overturn. They just have to make one exception. But could they also take this case and strike down the healthcare worker mandate if they chose to?
Well, Mike, we're actually going to be in front of the court this afternoon, sometime after 2:00. And our argument is, if they issue a restraining order, Dr. Skoly is going to be working all weekend so that he can start seeing his patients again come Monday morning. And he'll have a line of dozens and hundreds of people. And as we said, he'll do the neediest most.
All right, so that's a great
all
question.
we're
Are
looking
you
for.
saying they could decide today one way or the other?
We're asking for a temporary restraining order, meaning that today we receive a temporary order pending a full hearing. And during the time of the temporary order, the compliance order is restrained so that Dr. Skoly can go back to work and his patients can start coming in Monday morning.
Wow, Doc, are you ready to go back to work Monday?
If you were to offer me that luxury, I would. It would be like a soft opening, because I haven't worked in a while and it'll take some time to ramp up, but I will ramp up very, very quickly.
Wow, I didn't realize that things could happen that quickly. Wow, okay, so we're going to have to stay in touch with you guys and get some updates on this. All right, final question, and I thank you both for Doc Skoly. Doc, we talked about how this case is narrowly about you. You initially went public with your decision for medical, for constitutional reasons, for personal reasons, not to get the vaccine, and in essence, kind of tried to make yourself symbolic of all the healthcare workers who lost their jobs, because of the vaccine mandate, and especially those with naturally acquired immunity like you. Do you still feel, even though this case has a very narrow request, and do you still feel like you're representing other Rhode Islanders out there?
More and more every day. Remember, I'm not an anti-vaxxer. I've worked for USAID, which is an arm of the State Department. I've been vaccinated probably more than most people in the state of Rhode Island. With the history of Bell's palsy, with my surviving COVID, with my naturally acquired immunity, helper T cells, and all the science, I didn't need to take the risk of getting Bell's palsy because then I couldn't see these patients. My staff, my patients have never been at risk, just like all the healthcare workers who are unvaccinated. If they went back to work and they've survived COVID or entertained and accomplished their task with universal precautions, they're not putting their patients at risk. They've taken the Hippocratic Oath. Above all, do no harm. I mean, it's unfortunate when you look at the big picture here. The people that are actually doing the most harm right now are those that are dictating public policy at the Department of Health. They need to go back and review the Hippocratic Oath. So yes, I hope I am in a certain fashion representing others as well who have been abused. The healthcare policy people going forward need to get these people back to work. And then at some point, they need to offer a profound apology to what they've done because it's impacted an awful lot of people.
All right, Brian Rosner, you got me really intrigued. I got to go back and clarify, and just very quickly, I want to just understand the potential. I know the courts can do whatever they want, whenever they want, right? They can, but what the anticipated timeline might be. So they have this complaint in hand right now. This is the U.S. This, by the way, we file this in the federal. You file federal First Circuit, right, which is Rhode Island's district court, right? Is that First Circuit or First District? What's the proper term?
It's in the district court, which is part of the First Circuit.
Okay, so it's in the district court of Rhode Island, part of the first. Will there be any arguments today? You said you had a call or something, or will they just go with the written? We will have my understanding is that we will have a conference, a Zoom conference, in which argumentation will be heard based upon the papers submitted. And the state's attorneys will be part of that as well?
Absolutely. The state's attorneys have been notified. They've received all the papers. They no doubt will ask for time to put papers in. But our argument is that the emergency regarding Dr. Skoly is such, and the legal argument on his behalf is so clear. The harm being done is so clear. And it's so clear that he is ultimately going to win on an equal protection argument that really we need, in order to preserve his rights and those of his patients, to get him back as soon as possible.
While then the case unfolds.
And then the case will continue. We'll have a hearing on a full official preliminary injunction, a word temporary restraining order issued today. The judge could reverse it 2 weeks later at an injunction hearing, and then reverse that a month later at a trial.
Will we necessarily know by the end of today whether that temporary restraining order has been issued or not, or could they take a few days to think about it?
Usually, you know, by the end of the day, because it's an emergency immediate procedure. And if it's issued or if it's denied, it will then be set down for a preliminary hearing, perhaps in 10 days or 2 weeks, where the state will have a greater opportunity to marshal its evidence to argue that this order should not be restrained.
And how will Dr. Skoly and we be notified of the actions of the court today? Will you guys be putting out a media release? Will you send us a notice? My curiosity's peaked. It's like the bottom of my case is loaded. I didn't realize.
This case is publicly filed. Any order from the court will be issued on the federal government's website, the district court's website.
All right. And but you'll let us know one way or the other, right?
Of course.
Doc, did you realize it was potentially this imminent? I didn't even realize it.
I realized it could be, but because of my experience so far with the appeal process and everything, I'm not counting on anything.
Yeah, temporary restraining orders are rare events. And indeed, we're arguing that they're justified here, but they're rare events.
And there is a high bar for that, of course, but it does seem like everything's lining up. All right. And so to understand, you guys you filed at roughly 9 a.m. this morning, and the court then responded and said, we will have this 2 p.m. conference. So they proactively responded to that?
Absolutely. They asked if we wanted a hearing today. We said yes. And we're talking about available times. It will be after 2 p.m.
And do we know who the judge is? It one judge or a panel of judges? How does that work?
Forgive me, the judge has been assigned, but his name escapes me.
All right, if you would text us that later, so we can just put all the information out there to complete the story. Just little factual details we got to get into. All right, well, listen, we're going to be all sitting on the edge of our seat for the rest of the afternoon, especially Dr. Skoly. And I want to thank you both for coming on. Brian Rosner, you guys did some really terrific work. Thanks to your team down there who we've worked with in coordinating our media responses. Dr. Skoly, Steve, will be in touch with you shortly. Thanks for your comments, for your bravery in standing up for your personal and constitutional rights. And we'll have you hopefully both back on soon when there's some breaking news.
I want to thank you guys, and as well as my local attorneys, Greg Bricelli and Christy Durant, for representing me here, and for, Brian, all that you've done for me with your alliance, and, Sten, you've been with me through this whole ordeal, adventure, whatever you would like to call it. But it's important. Like at some point, I was realizing, oh, God, what country do I live in where I can't make my own choices? I can't have personal responsibility, and those around me, because of these government policies, their liberties and freedoms are questioned. It had to stop. So I'm glad I did it, but I couldn't have done it alone. So thank you.
All right. Well, thank you, Doc Skoly. Thank you, Brian Rosner. Stay tuned to this Ocean State Current website. Follow us on our Facebook and social media accounts. And as soon as we hear from Attorney Rosner or from Dr. Skoly how this emergency request was decided today, we will let you know on both of those platforms. So again, for the Ocean State Current, for the Rhode Island Center for Freedom and Prosperity, thank you for watching today. We'll update you as the news comes in. We wish you a safe weekend on this messy Friday. Good day.
Thank you.
Thank you.